Okay, Ian, Dr. Ian Norton, can you introduce yourself a little bit first, please?
So my name is Dr. Ian Norton. I'm Managing Director of Respond Global, which is a company, a social enterprise based out of Brisbane in Queensland, but also working here in Vanuatu on HELPR-1.
Okay, and your background, you're a specialist physician in emergency medicine.
Yes.
How has that worked in terms of what you've done and led you to this?
So I'm an emergency doctor, but that was quite a long time ago now, and I've been specialising in disaster and emergency response for about 20 years. My original role was to be the director in Darwin of the Australian Trauma Centre, and through that work I helped set up what is now the medical response teams for Australia back in the early 2009-2010 period. Led lots of responses for the Australian government to Typhoon Haiyan in the Philippines, dengue outbreaks in the Solomons, Pakistan floods back in 2010, those kind of things. And through all that work, I wrote what effectively became the global standard for medical response teams. It's called the Blue Book. It was working with WHO on one of their working groups, and to author this sort of standard to say, post-Haiti, when Haiti had those issues back in 2010 or so, there was lots of teams that came in with good intentions but didn't actually have any standards to meet, and some of them didn't actually do a great job. And so we set up this new global standard effectively. I went to WHO to work on that and to create a program within World Health Organization to run emergency medical response teams around the world, and I worked in WHO for about 6 years. And then in 2020, I decided, in early 2020, just as the pandemic was about to hit, I ended that work with WHO. I decided to come back to Australia and set up Respond Global. And the idea really behind Respond Global is that it's an organizational platform, logistics and operation support for national teams, because my work really showed that working with national teams and giving them the right tools and equipment and some sort of platform to work on, they have all the skills that they need really to do their operations. What they don't have is the logistics. So if a company or group could quietly come in and support them with the logistics, they are the right ones to do the response for themselves.
Okay, and we now find ourselves on HELPR-1, which I have to say is a fantastic vessel and a fantastic initiative. What's the catalyst and the purpose behind HELPR-1 here in the Pacific?
So that was really, COVID was one of the catalysts. There was a donor who wanted to work with us, so we put in from Respond Global company side some funding, and then also another donor has helped us with support to eventually purchase this vessel, and now it sits in Vanuatu. It's really for the whole of the South Pacific, but it's based here in Vanuatu. And what's really been shown in the last year or so is that there's support needed for day-to-day health operations, emergency response and preparedness work. And then it sits here ready to go post-cyclone, post-earthquake, post-tsunami and things. So it's a dual-purpose vessel. We really want it to be used day-to-day all the time to help access to remote communities, and then also to be able to respond in big disasters.
And as an example of that, one of the things we're obviously doing here on this front, you do obviously medical consultancies like checking up on health issues, but also we're taking a couple of guys doing biosecurity checks, things like that. So how does that, is that the purpose, that's the goal, is to have to serve all sorts of needs across the provinces?
It is, it's sort of, so I did a lot of work, as I said, in Darwin early on, and it was very clear that people who choose to live in more remote communities don't often get all the access to all the services that you would expect in the big cities of Luganville and Port Vila. And I think that equity change is something we should challenge. We should say, it's great that you live in West Santo and you should get access to at least basic services, so primary health care, certainly access to your area council members, making sure that there's good disaster planning, making sure that we can deliver bed nets. So that's what the vessel should be doing now. It should be, on this mission right now, we're going province to province to discuss with the provincial leaders and the area council leaders to say, what would you like at your area council level? Which services should we be bringing on board the vessel? We have enough room for about 30 experts from your local city or town. What gear would you like brought in? We can guarantee you'll be here 3 times per year in every single province for about 6 weeks of the year in each province. So it's a lot of work, but it has to be a multi-sectoral, multi-agency. It gives a chance for other partners to join as well. and to raise awareness about different issues and programs. As long as it's agreed by the local province and area council, we're happy to carry.
Okay, and as you said, it's the one vessel for the moment and it's based in Vanuatu. What's the ultimate goal for you? What's your vision?
Yeah, it's across, at least in the Pacific to start with, this idea that kind of high cost assets like a vessel like this should be shared amongst many countries. And if we can get some donors to contribute, government to contribute some money, and we will continue to contribute. This vessel sits there as an expensive thing that no one country probably could be able to afford, but if it's shared amongst several, it wasn't actually a vision at the beginning to be a vessel, it was going to be actually a cache, a set of equipment that could be called upon by different countries. The same vision would occur then in places like West Africa, where I've done a lot of work in Ebola before, and during the West African Ebola response I was in the middle of that for about 7 months. It was quite clear there was about 15 countries in that region that had that risk, but no one country could afford a big Ebola treatment center. If we could hold that centrally, we quietly look after it, make sure it doesn't go off, it's all ready to go at all times and everybody's trained on it, then it will just respond into whichever the countries choose to call on it for whatever trigger. So we'll agree on the triggers and then we'll have it available. So that's exactly the HELPR-1 model. Probably the vision really is to have several of these vessels across the Pacific, and then a different approach in land-based countries like in Africa.
Okay, and it's obviously being well received. I mean, the crew is obviously a mix of, from what I can gather, so Vanuatu,
mostly Nivan,
Nivans, and some Australians.
Yeah.
So that's obviously been well received. We've also, so far on this journey, we're about 4 days into it, 4 or 5 days into it. So we've done Sanma, Malampa, and we're about to do Toba.
We're in Toba now, yes.
So we're in Toba now. So in terms of meeting with provincial government representatives, are you pleased with how it's going?
Yeah, so the reception has been great. We already knew the area health managers and the public health managers in each place, but now to talk to agriculture, to fisheries, forestry, NDMO, so the disaster management authorities, their eyes are lighting up, and you can see they're going into overdrive, thinking about what they could get out of this. They struggle to get to where they need to go. So for the biosecurity group who are on board with us now, they've said already the 3 or 4 trips they did in Torres alone would have taken them several weeks to accomplish, and they've done it in about 3 days. Yeah. We had the same sort of feedback from groups who were doing vaccination in Tafea, let's say a couple of months ago, where to go island to island and to run a health program on dental care, eye care, reproductive health and women's health, and do childhood vaccination all in one program. So we're already happy we've got the health model right. Now we add on NDMO and policing and education. It's a really good boon for the provinces, and if they know that we're going to come and guarantee to come 3 times per year spaced apart, and they can use us to carry equipment that is going to cost them a lot of money to ship in, that's really quite impressive. We've already done some work in, let's say, oxygen bottles as one example, where we went out and found that some donations had occurred where oxygen bottles were given to the communities, but they were given empty. So we've had to take them back into Vila to get them filled and then carry them out again. And now we have an oxygen concentrator on board, so next time we'll just refill as we go and go village to village.
Okay. So also potential partners, would you be looking at NGOs? Would you be looking at larger governments, e.g. Australian government or New Zealand government, like regional governments, as opposed to the smaller governments? Or NGOs?
Yes, so we'll work with all sorts of partners. Some of them are donor partners. So a couple of examples. Contributing to HELPR-1 allows your program from whatever country or partner, NGO, you've hoped to put in place in a place like Tafea or Toba here, which is hard to get to. You can, first of all, sponsor the local government to actually implement more effectively. And secondly, you actually can be welcome to jump aboard with 1 or 2 of your officers to check how that program's going. So that's quite a unique, usually when a donor gives money or the partner NGO, they'll never be able to actually see. But this time now you'll be able to go and check routinely every couple of months as well, which is kind of a different monitoring approach.
Yeah, okay. All right, thank you very much for your time.
Pleasure.